Welcome to everyone who is joining us in webinar number 229 since the Andean Health Organization Hipólito Unanue Agreement started the webinar cycle in May 2020. It is 4 years of continuous learning since we started this cycle of webinars. It is a pleasure for me that today this webinar is carried out in conjunction with Rotary International District 4455 through the Mental Health Committee. The title of this webinar is Practical Mental Health and Wellness Resources Anyone Can Use. If you want, we invite you to leave your name, organization, and country in the comment box of the Facebook Live or YouTube Live chat. In the same space, you can leave your questions or send them via email to webinarhorasconu@gmail.com. To access the certificate of attendance, as usual, in any of the Facebook Live or YouTube Live chat, you will find a fixed link where you will have to fill out a short survey and leave your data as email. Please verify that your email is correctly written. In this webinar, we will begin with the institutional greeting, in this case by me, because I'm also going to moderate this meeting. So welcome. The topic of mental health is a topic that has been and will be a topic of great concern, especially during the pandemic. After the pandemic of COVID-19, there was an increase in the mental health disorders, being the most frequent anxiety, depression, and others. It has been calculated that 1 out of 4 persons is going to have a mental disorder at some point in their course of life. And it is also known that there is a very high percentage, almost 50% of these disorders start before the age of 14 years and between 70 and 80% before the 18 years of age. So it is very important to make an early diagnosis of any mental health disorders. Sorry. It is important, and that is why Rotary International has the advisor group worldwide in charge of the mental health initiatives, so that we would like to welcome Bob Anthony, who is the chair of the Rotary Action Group on Mental Health Initiatives. He, the executive director of the, he chairs the group for Rotary for Mental Health, ragformentalhealth.org of Rotary International. He has been a driving force in making polio eradication feasible through his local presence through Rotary clubs in more than 200 countries. The task force helps these clubs break the stigma, raise awareness, and increase access to prevention and early treatment of behavioral health challenges. Bob has facilitated the implementation of behavioral health projects in the United States, Puerto Rico, India, and Nigeria. He is also the executive director of Adolescent Wellness, Inc., AWI, a nonprofit organization he founded in 2005 after a 20-year career in the technology sector. AWY promotes the development of practical resources to prevent mood disorders and encourage earlier treatment. He moved to Naples, Florida from Boston in 2019 with his wife, Nancy. They have 2 children and 2 grandchildren. For us, it is an honor to have Bob, and you have the floor. You need to unmute your microphone, Bob.
Well, it's going to go downhill from here.
Yeah.
I am delighted to be here. I am grateful to be here. And I am thrilled that the topic is mental health initiatives. This is something that I have been interested in for 20 years. I had a direct experience with depression when I was a young man of 50 years old. The reason I'm here tonight is to introduce some things that I had a hand in developing and that anyone can introduce to their community. This is important because we're all wanting to do the right thing and we're fearful of doing the wrong thing. And too often that means we do nothing. So tonight, we're going to talk about lots of things that can be done. I'll discuss 2 in particular, and a friend of mine will follow immediately and talk about a 3rd thing that anyone can introduce locally. It doesn't take a lot of money, it doesn't take a lot of time, it just takes a passion. I'll put together a slide. Let's light this up. So hopefully you're all seeing the screen. Okay. And it is indeed talking about practical mental health and wellness resources. One advantage that Rotary members have is that we're local. There's 40,000 clubs around the world, even around Lima. If you type in Rotary clubs, you'll find within 25 kilometers that there's dozens. And we're trusted. I mentioned my passion for mental health, but I have no degree in the topic. My degree, I'm a certified public accountant. My MBA is in finance from schooling. My 25-year career in the tech industry was on systems integration. None of that has anything to do with public health or for individual health. But the things I'm talking to you about tonight do not require a degree to introduce them. If you think about those 40,000 clubs around the world, imagine if every club posted the best resource that they've discovered around mental health improvement in their community. Well, that's a little bit of what we're going to introduce. This is a page on the website, the ragonmentalhealth.org website. There's menu options along the top. You can see circled in green, the one labeled resources. And by going to that website, you have a selection of languages. And these are the 8 official languages of Rotary. And the bottom of the page, hopefully you can see displayed Spanish. By selecting that, all these resources come up that are in Spanish. We would love your club, we would love your district to add things that have proven very successful in your community. But what we have right now is a short list of proven resources that anyone can deliver. The very first one is to deliver to your Rotary Club. Every club in the world has a presentation, whether it's breakfast, lunch, dinner, or just when things are convenient for everyone. And anyone in the club can present the PowerPoint. So the first resource is a toolkit called Looking Inward. And on that web page, there's an explanation, there is a survey, and there's a PowerPoint. Clubs around the world have delivered that PowerPoint to themselves, and its result gives a snapshot of how members are feeling, how well the club improves their mental well-being. So here's a quick example. The survey from my club had folks that were members for over 5 years. And one complaint was that they didn't feel like they were at the table where the senior club people were. They had unconsciously formed a bit of a clique. And the solution was very simple. Once a month, we assign seats as people arrive. And it just makes conversation with new people automatic. There's hundreds of examples that people have suggested through this survey. And my club developed it. There's a psychologist named Sharon Carter that put it together as a request from President Gordon McAnally. There's an article in the February 2023 Rotary magazine, if you'd like to read a summary of the 1,000 surveys from Rotary members around the world. We hope you look at that PowerPoint, take the survey, and we're happy to give you the results of the survey. It's all anonymous, and it takes just 15 minutes for your club to complete that presentation. Another arrow on the same screen talks about launch your district chapter. You'll hear more about that in a few minutes in a separate presentation by past District Governor Rafael de la Rosa, who's also a leader with the District 4100 chapter of the Mental Health Initiatives Rotary Action Group. I'm going to focus on one resource and then turn it over. The same website has toolkits in English, and that's my native language. This one's called A Lever, and it is a very effective means to increase capacity for early treatment of children and teens for mild and moderate symptoms of anxiety, ADHD, or depression. Again, anyone, including you, can introduce a lever to a family doctor to increase treatment capacity. The resource has 2 languages. One is geared towards the professionals, the doctors, the nurses, and it's a web-based, self-paced training to diagnose and treat ages 6 to 17 with the most common maladies of youth. The Spanish resource set is for use by the patient, that's the child or the teen, as well as the parent. So the doc does a series of video clips and tests. They're each just 20 minutes. There's 16 altogether. And they get 5 hours of professional continuing medical education training, which they need anyway. These are issued by the American Medical Association. If those are not honored in your country, it is very straightforward for us to work with your local hospital and have your local hospital issue the continuing medical education credits. We've done that. Boston Children's Hospital is happy to do that with you, and we're happy to facilitate. The reason these resources are so important is because early treatment's important. Half of all psychiatric disorders begin by age 14. If they're not treated, they harm your physical health, they harm your happiness, and they harm your productivity. And for the youth, that's really meaning how well they do in school, even whether they stay in school. And this is huge because the average delay is 10 years between first symptom and first treatment. And that's for the lucky group that gets treatment. More than half never get treatment. And the delay is caused by the fact that docs can diagnose, but then they refer out to specialists, like a child psychiatrist, who are too busy for new patients. So as a result, the child doesn't get treatment or gets put on a wait list. The solution we're talking about here is very straightforward. The toolkit called Alever simply task shifts to overcome the shortage. And it does that by giving additional skills to the pediatric prescribers. I'm talking about nurse practitioners, family doctors, pediatricians, physician assistant, anyone who currently prescribes medication for a child or an adolescent could fully treat 80% of cases. I'm talking about all mild and moderate cases of anxiety, depression, ADHD. The reason they don't is time. They are already busy. They're plenty intelligent. They could complete the training pretty easily, but they still don't have time to have a 20-minute conversation with a mom explaining why their child's in the situation they're in and the path to the solution. There's also a reality that if they were trying to spend 20 minutes or 30 minutes with a family, they couldn't get paid for it very easily. So time's a huge factor. And of course, time precludes taking the training. And without the training, even just 5 hours, their confidence is not high enough to begin treatment. So it's just like you and me. We're not going to do the wrong thing. Therefore, we do nothing. In my town, this program was implemented. And I'm talking about Naples, Florida, in Collier County in the United States. The doctors took a pre and a post set of questions, and their behavioral health knowledge was about half accurate. After this 5-hour training, it was 98% accurate. It's a massive improvement. Related to that, their confidence, their behavioral health confidence went from below 50% all the way to 99%. That's huge. And of course, the critical outcome is their intention to treat. So that third line that talks about behavioral health intentions is very strong at 94%. So the lever also addresses time to treat by providing a quick solution for a youth with mild symptoms. The doctor prescribes the indicated guided self-management toolkit the same day a child or a teen screens positive, as opposed to a referral out. And an additional benefit of treating the patient directly, the child can do these on their own. It's written for a 6-year-old to understand. There's also a toolkit for the parent. And so the parent partners with the staff in the treatment the same day the screen is positive. And it doesn't take time from the doctor because the nurse is handling it or another person in the office. That may be all that's required to put a stop to the symptoms worsening if it's a mild case. If it's a moderate case, when they check back in with the nurse a month later to talk about how far they've gotten in the workbooks, and they come in for a focused assessment, and perhaps medication is required. But that's all managed in the training, and they're already making progress. They already understand the malady, and they already understand it's not just them. And most importantly, they understand that there's a path to getting better. This is a video from the impact on one family in my town, and it's all because of my Rotary Club. This would not have happened without Rotary. We'll remember our people of action, and I encourage you to present the looking inward slides to your club. Introduce a lever to your family doctor. If someone in your club is connected to a healthcare network, ask to meet with the medical director. Ask to meet with the chair of pediatrics. They'll recognize the quality of these toolkits, and they'll want to implement it. This is a new resource. that is not very well known. It was released a year ago by Boston Children's Hospital. We have 1,500 pediatricians who have completed the program, but almost all of them are within the United States. There's just a few beyond that have started to become. I encourage you to introduce it. And I also encourage you to get ready for a wonderful presentation by past District Governor Rafael De La Rosa. He's going to talk a little more about launching a district chapter and ideally posting some of your most successful projects on the Mental Health Initiative's website. Thank you.
Muchísimas gracias, Bob.
Thank you very much, Bob, for your excellent presentation. What you're telling us is that there are ways in which we can help without the need of having so much degrees and knowledge. And the importance is that we have tools that are evidence-based that can be used and that we can do this through our Rotary clubs, because in the 4455 district, we have 108 Rotary clubs, 49 Rotaracts, and 11 or 12 Interacts. So we're going to look for those toolkits from Boston Children's Hospital, and we'll see how can we use them. The video has been very clear. What parents need is support, and to give them what the two physicians mentioned is to give them guidelines to continue in this relationship with their children. Thank you very much. Please stay in the room until Rafael finishes his presentation for the Q&A. Thank you so much.
My pleasure. Thank you.
Now we're going to introduce Rafael De La Rosa. He's the district governor of 4100 2023-2024 on the Rotary Club Caborca in Sonora, Mexico. Rafael belongs to this club. He's a governor, district governor. In June, he'll be ending his period. He's a member of the Rotary Action Group of Mental Health Initiative, known as RAG-MHI. He's a member of the International Rotarian Fellowship of Healthcare and Wellness Professionals, the IRFHP. He's a biological chemist by profession, academic for 35 years at the University of Sonora. His wife, Lorena Yañez, he's a father of 3 children, grandfather of 3 granddaughters. He lives in Caborca, Sonora, Mexico. Go ahead, dear Rafael. Thank you. I would like to share my screen.
No, primero que nada, un
First of all,
agradecimiento por la apertura.
to thank you for giving us your time. Thank you for the invitation, for sharing and giving me the opportunity to share this experience. So before going into the topic, I would like to say that the initiative of mental health was a task that our international chairman, Gordon McKinley, left us to governors at that time. And given that this is an initiative and an opportunity to extend what Rotary does, well, we did some follow-up. The ideal path is the Rotary Action Group. And I'm going to, I know that you already know this, but these are the ideal steps to generate what we know as a chapter in mental health initiative for this group, action group, which is our goal in this case. And I will mention it. When we review the Rotary Action Groups, I'm showing the webpage that Rotary shows, and you should not confuse them with the Rotary groups. In the case of action groups, these are groups acknowledged by Rotary, and this recognition has something to do with something that I'm going to mention later, that is the regulation or that a chapter must have in order to be part of this action group. This part is known by you because this is an extract of my Rotary, and if you see, these action groups are focused in our areas of interest. Within the area of interest, such as is expected in fight against diseases, we see the mental health initiative. If you can see in the different sections, here we will find this topic, and we are going to go to that link that it will take us to this page. As our good friend Bob has already mentioned some characteristics, and we will go directly to this topic. And this page, although this is action, we see this in English. This we can have this page in Spanish. This one is in English. When we see the tools, as Bob mentioned, we're going to look at the resources, and if we look here, we go to the Spanish part because we are trying to establish a chapter in mental health to be part of this group of mental health initiatives recognized by Rotary. And here we're going to find among the different options of help how to launch this mental health chapter, which is this one. Create your own district chapter. So once you enter there, this shows more extensive documents, and that your district committee will review them, and we're pleased to help you in any way. Now, what does this mental health chapter covers? And here we are committed to what are the intentions. Well, it has a population and a goal. Well, it's for Rotary members' interest in breaking stigma and situations around mental health. The goal was to establish a link between your district and the Global Rotary Action Group. And this becomes an opportunity, so some clubs can also establish goals, because some of those goals is to the participation of action Rotary groups. So this becomes an opportunity for them. In addition, we can also communicate about our ideas and resources and how to participate in projects. And once this Rotary Action Group is generated, the district creates a district division, and I am pleased to know that you have one of these divisions, but also the district committee will state their vision and mission and will document it in sending to the action group. The step number 3, and this is very important, to obtain the signature of current
electo y
elected
propuesto.
and proposed district governors.
En Rotary en ocasiones caminamos por algunos
In Rotary,
proyectos
sometimes we
que
have
normalmente
projects
duran corto
that
tiempo,
usually
¿no?
last
No, eso no quiere
short
decir que
time.
no sean buenos, pero aquí
This doesn't mean that they're not
tenemos
good,
la intención y
but
el
here
Grupo de
we have
Acción
the
Rotaria
intention, and the
es,
Rotary Action Group
tiene la intención y va a
has the
seguir
intention,
para que esto no sea
so this
algo solamente de
is
un
not
grupo, solamente
something
de nosotros,
from a
sino
small
que
group,
compromete
but
al
commits
distrito
the
y
district
para que esto, si en un momento dado
so
el
that
siguiente
at some
gobernador
point
hace
the
algunos
next
ajustes,
governor
cambios,
can make some
propuestas,
adjustment, changes, or
este paso ya
proposals.
esté dado. Es
This
decir,
step is
es un
properly done.
proyecto a largo,
So this is
a
a
largo plazo
long-term
basado en la
project
continuidad.
based in the
Y
continuity.
esto es excelente.
And this
Porque
is
nos permite
excellent
hacer
because it
proyecciones no
allows us
únicamente
to
con
make
logros
projections not
típicos a
only
un año, sino
with
a siguientes años.
achievements in 1 year, but
Siguiente
in the
paso es
following
adoptar el
years.
reglamento
The
del
next step
Grupo de
is to
Acción
adopt the
Rotaria. Es por
bylaws of the
eso
Rotary Action Groups.
que
That
los
is why
capítulos insertos aquí,
the chapters
este Grupo de Acción
in
Rotaria
this
tienen ese respaldo
Rotary Action
Rotary
Group has this
y
backup
esa
from
validez.
Rotary
Hay un
and the
reglamento
validity.
en este mismo
There is
material
a bylaws in this
podemos tener un
material.
reglamento base de los grupos de
We
acción
can have
rotaria, el cual
a
nosotros podemos
basic bylaws
hacer
for this
algunas adecuaciones
Rotary Action
y
Group,
contravenirlas, lógico, porque esto es
and we
acorde
can do some
a los lineamientos
modifications
rotarios.
as long as they follow
Y una
the
vez que los
Rotary guidelines.
analicemos, quizá
And
nos
once we
podamos
analyze them,
hacer
perhaps we can make
algunas
some
adaptaciones a nuestras condiciones.
adaptations to our
Y una
conditions.
vez que tengamos esto, pues vamos a
And
presentar
once
esos documentos
we will submit
completos.
completed documents.
Una vez que se apruebe esta solicitud,
Once this request is approved,
enviamos nuestro registro,
we send the
vemos la opción
register.
que
We
nosotros
see
tenemos de registro y
the
pago
option
correspondientes,
for
que
registration
es
and payment
muy accesible.
is quite
Después
accessible.
aparecemos en una lista
And
ahí
then we will
desplegada de
appear
quienes
on a
nuestro distrito
list
ya
that
pertenece
shows
a
that
este
our
grupo.
district belongs to this group.
Vamos a recibir un
We're
logotipo,
going to
algunas
receive a
instrucciones de
logo
cómo nosotros
and some
sumarnos a
instructions
ellos,
of
y
how
cómo ir
we
sumando a la
are
vez
included and how
a
to add
integrantes que nosotros vamos a
additional
sumar
members
a este capítulo del
to
Grupo de
this
Acción Rotaria, ¿no? Es
chapter
decir, si
of
nosotros
the group, Rotary Action
abarcando
Group.
30
If we have,
personas
for
para este
example,
capítulo,
30
pues
people for
adelante. Y
this chapter,
recordemos que no es únicamente
and let's
abierto
remember that
para
this is not
socios
just
rotarios.
open
Aquí
to
podemos
Rotary
invitar a
members. We can
profesionales
invite
en el tema para que
professionals
nos
on
ayuden
this
a
topic
redondear
so they can help us
implementar lo que nosotros
and do
buscamos.
the implementation of what we're looking for.
¿Y qué beneficios tenemos?
And what benefits do we have? Well, first of all, these action groups are open to everyone in the community. We can do some joint activities between members and district divisions and clubs, and everything that we can see in the slide. Can you read? And of course, in the last two bullet points, guidance on the use of local resources, like some of that Bob mentioned, and also project advice that the district would like to implement.
¿Qué asumimos nosotros como distrito para ellos?
We,
Bueno,
as a district, what are responsibilities? Were to recruit community mental health professionals, to address the community needs, that is, make sure that this is not to look for specific situations in the community where we're going to work, to identify resources that we're going to use for this, and to provide materials for district events, and if desired, also speakers.
¿Cómo podemos nosotros ir dando?
How can we give some steps? What we can start, I must mention that when we started this chapter, we started without cases, without now knowing how to do. We just sent the email to Bob, and he immediately responded and they contacted us with a person that would provide follow-up in this corresponding area. In this case, it's with Moni Black, who Bonnie Black was very ready to help us, and she was key for us to have the opening of our district chapter. And I show the document, the signature of governors in this District 4100. This format is available among the tools that the chapter offers. This facilitates us. And finally, you receive a certificate of charter document like this one. So I'm sure that you will do it and to offer your commitment to generate and invite other districts and more people that you know to increase this Rotary Action Group through the district chapters. This is an excellent opportunity. I think that this allows us to focus and to follow a path such as the one that we had at the beginning with initiative from our international president had. Thank you very much. This is a short topic, but we are available for any type of support and counseling. Thank you very much, Rafael. In a very specific manner, you told us how can we proceed for this chapter in District 4455. We would like to share with you that we also heard Gordon in Melbourne, and he spoke about mental health and the importance of mental health, so that when we return with the support of our Governor Oscar Torres, that I see him around, is that we inaugurate this mental health committee in District 4455. And during this year, we've carried out activities in relation to mental health. Among the activities that we've carried out, we had webinars in relation to the stigma and mental disorders, in relation to depression, alcoholism, mental disorders in the course of life. We have also shared 53 videos of mental health to the entire district, and we've also been part of the campaigns of the Ministry of Health of Peru, these campaigns in relation to mental health, the prevention of suicide, which is a date that we celebrate the suicide prevention. And now, when we went to Singapore and we discussed with Bob, and now with what Rafael has presented, I think that we are on our way, and we are going to comply with everything that's required in order to have this chapter for District 4455. And yes, I don't anticipate any problem. We have the goals, the vision, the mission, and we will continue working for that. Thank you very much for the presentations. If there are any questions, please, for the speakers.
Yo quisiera hacer una pregunta.
I would like to ask a question. The topic of the Boston Children's Hospital. This is a tool for children, right? To work with children and adolescents.
That's correct.
Could you expand a little bit more about that tool?
Certainly. I'm going to screen share here, and hopefully I can easily bring up an example. So are you seeing this document on your screen now? So
Ujú.
this is one of 10 toolkits, and the doctor would prescribe it. So the normal practice in my experience is that a family's attending a family doctor. While they're waiting, they answer some questions on a piece of paper. The doctor calls that a screen. And by viewing the answer to a short number of questions, they can get a flag that the child has mild symptoms of anxiety or depression or ADHD. And they can act on that by referring it out to a specialist, like a talk therapist, or if the symptoms are extreme, perhaps to a child psychiatrist. But the doctor could actually start treatment herself or himself. The doctor could prescribe that same day as a diagnosis that the child have this document to read, and they can read it. It is written for their age group. And it has exercises that are typical for evidence-based cognitive behavioral therapy. So they work through this set of coping skills, and hopefully no medication is required. The reason this document is so important is because it's issued directly to the child and the doctor can move on. The statistic in the United States is 7 minutes. A pediatrician has 7 minutes with a patient and then they're on to the next patient. So even if they're confident in treating what they read in a positive screen, they don't have time to explain it to the child and explain it to the parent. This allows them to literally hand a piece of paper to the child and hand a different piece of paper to the parent and say, the nurse will explain this, and they move on. So this makes it practical to treat immediately these early symptoms, these mild and moderate symptoms. And then there's a follow-up protocol in the office where 30 days later, they follow up to see whether these activities are understood, are being implemented, whether the child's compliant. And if things have not improved or if things have worsened, they schedule a focused assessment. During the focused assessment, they go further to determine whether perhaps medication's involved or it's becoming more critical to see a specialist like a talk therapist. But they haven't waited a month to begin treatment. The child's begun treatment. He's already more relaxed. They understand he's not different. This is not anything that is unique. And there's a path forward to get healthier, to feel better, to be happier, and to be able to pay attention at school without getting in trouble. So it's a big deal. It makes a complex topic simple. So this is one toolkit I'm flashing by in the background. That's one of 10. This is for anxiety age 6 to 12. There's another one for anxiety age 13 to 17. There's another one for anxiety for the parent. And then you repeat that for depression. You repeat that for ADHD. And there's a 10th one that is unusual. It's for a younger child, age 3 to 12. Anyway, beginning at age 3, and it's for disruptive behavior disorder, catching that early. I hope that was answering the question.
Excelente, de una manera muy práctica,
Excellent,
¿no? Ya vimos
very
los
practical.
módulos,
We've seen those models,
creo que los vamos a,
and I think
creo
that
que los vamos a utilizar.
we're
Vamos
going
a
to
ver
use them,
cómo podemos
and we will see
conversar con el
how can
Children's
we
Medical
discuss
Hospital
with the
para ver si podemos
Children's
hacer
Hospital
alguna,
to see if
algún,
we can
algún acercamiento, ¿no?
do
Para,
some approach.
dice que estas herramientas tienen
You
un
mentioned
año
that these
y son valiosísimas,
toolkits
¿no? Digamos,
are very valuable.
vamos a ver en el distrito, porque nosotros
We're
en
going
el
to
Perú
look at them in the
contamos
district
con los centros
because
de
we in
salud
Peru
mental comunitarios,
have
en el
community
Perú hay
mental health
más
centers.
de
We have more than 270 community centers for mental health, and we work directly with the mental health office of the Ministry of Health. And I think that these tools will be extremely valuable
llegar, pues, ¿no? Para poder,
to
para
reach
poder mejorar,
and
¿no?
improve
Mejorar el tratamiento
the
y una cosa
treatment.
importante, que no
And something
abandonen el
important is that
tratamiento,
they
no
don't
abandonen, ¿no? Porque a veces,
discontinue
como
treatment,
no
because
se les
sometimes
responde
because
adecuadamente
we
o
don't have an
rápidamente.
adequate response.
Acá también en el Perú no son 7 minutos.
In Peru, it's not 7 minutes, but it's also a very short time with the visit to the pediatrician.
¿No? Acá hay una pregunta,
There is a question.
¿Cuáles son
What
las actividades
are
que
the
están, digamos, priorizando en el tema
activities
de
that are being
adolescentes?
prioritized in
Esa
adolescents?
es la pregunta. ¿Qué están
That is the question.
priorizando en el
What
tema
are
de
you
adolescentes?
prioritizing in adolescents?
So if I understand the question, it's how the toolkit I just showed is different for a older child. If that's the question,
Eh,
yes.
Lo que están preguntando es
What they are asking is what
están priorizando
what actions
en el
are
tema
you
de adolescentes.
prioritizing for adolescents?
¿Qué acciones? No
What
solamente herramientas,
actions,
sino
not only
qué
tools, but
acciones.
what actions are you taking for adolescents?
So if we're still talking about the same resource, the identical activities that we saw for the younger child are listed for the teenager. They're simply formatted with a little more mature language, so it doesn't feel as much as a
Perfecto.
child's toolkit.
¿Mm?
Have I answered the question?
Creo que sí.
Yes, I think so.
Y hay una pregunta de Julie.
And there's a
Creo
question
que
from Julie.
Carlín, sí, por favor.
Carlín, go ahead.
Puedes salir del... Ya, perfecto.
Okay, gracias, Maricarmen. Thank you
Thank
so
you.
much, Bob, for your for all that you say to us. It's very important for the grandmother to know about this, because our grandchildren are sometimes in problems and we cannot help them. Thank you so much. And how we can reach all these documents that you told us.
Thank you for asking. The question is how to access these toolkits that I've illustrated. And the introduction to the doctor is to a bundle from Boston Children's Hospital. That bundle is detailed on the regonmentalhealth.org website. The doctor signs up for a course. It's a 5-hour course. And upon completing the course, there's a manual documenting what the clinician just learned. In addition, there's these 10 documents. So they're all in digital form. And the doctor has free exercise to prescribe it to as many families as indicated. There's no limit on their use of it. The single restriction is that the doctor can't just put it on the internet. You know, it's not intended just for, general distribution. In my county, we have a school district mental health work group. And there's a group called NAMI that's based in the United States. I suspect there's similar groups that are families with children who have been diagnosed. So it's a pretty passionate parent group. And what they do is ensure that all of the doctors that take care of their kids have completed this course. So it is through the doctors, and then it's distributed by the doctors to the families. And they're encouraged, the families are encouraged to go ahead and share it with whomever they trust. Share it with grandparents, of course. But if they want to share it with a school teacher, or if they want to share it with a counselor, that's perfectly fine. But it's issued by the doctor to the family. I'll add one more point. The reason I keep bringing up the doctor is because there is a shortage of child psychiatrists, and there are some forms of mental illness that do require medication. The most obvious example is ADHD. A third of the kids can manage it once they understand it and once they're giving some exercises. But that means 2/3 are still struggling with it. And so you don't want to skip the doctor. We do want an accurate diagnosis, and we do want the doctor to be involved going forward in case medication is appropriate. One final point. To make this a training that the doctors took, as opposed to the 100 other trainings that the doctors can take, my Rotary Club made it a scholarship. So in the USA, training one doctor cost $250 US. And that gives them 5 hours of continuing medical education, which they need anyway, but it makes this the course they take as opposed to something else. Everything else is free.
Perfecto. Muchísimas gracias por las exposiciones.
Thank you very much for your presentations.
quitar
We
más
don't want
tiempo,
to
han sido
extend the
súper
time.
prácticas.
You've been very
Bob,
practical.
Rafael, seguiremos
Bob and
en
Raphael,
contacto para
we will
seguir
continue in
trabajando y logrando
touch
que el
to
capítulo
continue working and
44
make the District
tenga su capítulo.
4455 has
En este
its
momento está con
chapter.
nosotros
At this
el
moment, we
gobernador
have
del Distrito
the
4455.
Governor of District
A quien le doy la
4455,
palabra para el
whom I
cierre
will
de
give the floor to
del webinar.
close this
Nuevamente,
webinar.
muchísimas gracias,
Once again,
Bob.
thank you so much, Bob.
Gracias,
Thank
Rafael.
you, Raphael.
Gracias.
Thank you.
Muy buenas noches.
Gracias.
Es un
Good
gusto
evening.
saludar a todos.
It's a pleasure to say hi to all of
Muchas
you.
gracias, Bob,
Thank you very
por tu
much, Bob,
participación.
for
Un
your
abrazo muy
participation.
grande a mi
A
compañero de
big hug
promoción,
for
Rafael,
my
que ha
fellow
tenido un
Raphael,
maravilloso año
who
en
has
la
had a
promoción,
wonderful
creando
year as
esperanza.
governor, creating hope around the world. And we are
La última actividad
closing
de
the last
promoción con este
activity of
maravilloso
this
comité
governor with this
de salud
wonderful
mental, que ha
committee
sido muy
of
intenso,
mental
con
health
su
that has
presidenta,
been quite
pero
intense
muy eficaz,
as its
muy eficaz.
chairperson,
Muchas gracias
quite
a todos.
efficient. Thank you very much.
Deseo todo lo mejor.
I wish the
Felicitaciones,
best.
María del Carmen, por este
Congratulations, Maria del
comité
Carmen, for this
liderado
successful
durante
committee
todo
that you
este
have
año, y les deseo todo lo mejor.
led this year, and I wish the
Siempre para
best
todos ustedes. Un abrazo muy
for all of
grande
you.
de aquí
A big
de
hug
Arequipa.
from here, from Arequipa, Peru. Thank you.
Muchísimas gracias.
Thank you very much.
Buenas
Good
noches a
evening.
todos.
Buenas noches.
Good evening.
Muchísimas
Buenas
gracias.
noches.
Thank you
Nos
so
vemos
much.
pronto.